Welcome back, everybody, to the now monthly Holistic Actions Q&As with Dr. Christina Chambreau and myself, Jeff Feinman. And we're here to help answer your questions while we walk together on the path to pet wellness that also is going to make us better and our planet better. And Dr. Christina, do you want to get going? Or do you have anything else you want to say about the microbiome month that we just finished or anything else?
Well, I'm visiting people as I move towards Reno to the Holistic Veterinary Medical Association conference and a memorial for Dr. Carvel Teekert, who founded the American Holistic Veterinary Medical Association and died earlier this year. So at one place, I was helping my friend get her house ready to sell, and we did a lot of major work, hard lifting, heavy things. And so, as a treat, after 10 days, she treated me to a Korean spa. And they do this skin rubbing thing with, your whole body. And usually I've always just loved them. But after listening to Julianne Lee's skin microbiome, like we shouldn't be washing our dogs and our people and ourselves so hard. And I'm going, oh my God, I'm killing all of my skin microbiome while they're doing my scrub. But then they had, Julie Lee had talked about finishing your rinse when you're washing your dogs when you need to wash them with tea. And in the spa, they had a big, huge area, a huge big tub of tea that you could take a ladle and cover and pour tea over yourself.
Huh.
So I poured tea over myself and said, good, I'm helping replace my microbiome. So all of these talks have you start thinking, it just expands our thinking, whether it's about our animals or about ourselves. And we have to remember, and as we answer questions today, and please go ahead and start posting your questions if you have them. Um, Remember that there's no one right answer. It's not bad to do something. So was it bad that I got a scrub and got rid of all of my microbiome? No, it's going to get replaced. I just won't take a shower for a week or two. Whoops. Oh, well, maybe something like that. So it's a matter of paying attention. Those of you who are cuddling your dogs, those of you who have your cats climbing all over your bodies, you're replacing your microbiome. You're sharing your microbiome with each other. And that's a really good thing. So that builds health. And the more we build health and prevent problems, the more, the better the planet's going to do because we'll be using fewer chemicals, we'll be using fewer drugs, the more we maintain health. And so our young people will be able to grow into a wonderful planet. So as we answer questions today, there's some basic key things. One is, I'm double checking, Dr. Jeff, they get the chat sent to them with the recording or just the recording?
If the chat has a lot of good stuff
Okay.
in it, then we will.
So if there's a lot in the chat, we'll send it to you, but you do get the recording of this. So you can listen back to anything that you wanted to hear, that you missed. And you'll notice that there's a theme to our answers. We frequently say we want to rebalance the energy field so the symptoms naturally go away. And if needed, we can soothe the symptoms to make them feel better while we're working to do that rebalancing. And we're focused mostly on this rebalancing and the energetic approach. And it's really good if there's serious problems to be having a homeopathic veterinarian virtually on your team or locally, and a local acupuncture, Chinese medicine trained osteopath, chiropractor, or very often you're really blessed and you have somebody who can do energy healing, laser, ozone, along with these deeper modalities. So putting together your healthcare team, for those of you who are new here today, putting together your healthcare team now is important. Don't wait until you've got critical illness. And if there's critical illness, you will hear me say, please dig in right now and make an appointment immediately. So that's just and sometimes looks like we're not having tons of questions yet, but they are now starting to come in. So sometimes if we're starting to get short on time or we don't want to spend too much time if we have a ton of questions, if you feel I'm cutting you off rudely, please accept it in the spirit that we're just trying to get everybody answered, at least get people started down the right path. So, Dr. Jeff, you're going to need to chime in here a lot with Linda and polycystic kidney disease. But the main thing with polycystic kidney disease, or with any disease, and the other piece for everybody's questions, is come to Holistic Actions. And if you're not a member, for free, you can take the 101 Holistic Health Pet Healthcare course. And that's going to talk about the supportive measures for any disease, including polycystic kidney disease. So we're talking about nutrition and minimizing toxins and using happiness and focusing on the positive. And if you are a member, of course, that's available to you. And if you're a member, make sure you've done it and maybe even reviewed it. So Dr. Jeff, and then of course, for Linda, you do need to be working with a really good holistic vet. And if you want to unmute yourself, Linda, you can, if you're in a place where you can talk, you can chime in and tell us that you already are doing many good things. But I would be working for sure with somebody who is uh, working on that underlying energy field imbalance. How about monitoring for changes, Dr. Jeff, and how often?
Well, that is a great question, but I first want to say, what Angela already knew about this, but if anyone has any questions, you can either write them in the chat or raise your hand. And you raise your hand by clicking on the React button at the bottom of your Zoom screen. And there's a little hand, or it actually says lower hand or raise hand. So, all right, so let's
And
go
Angela
here.
posted as well. So Linda, that's
Good, yep, starting with Linda. I guess the answer to monitoring would depend on is it a dog or a cat? Did Linda
Linda, are
can
you
we hear
able
you?
to speak? Well, let's just in general,
Well, the most common is the cat, polycystic kidney, and it may be genetic. Like it is in some breeds, Persians have genetic polycystic kidneys and Abyssinians, and well, actually, more and more dogs and cats are now getting kidney disease in general, the polycystic kidney disease. In addition, and they're all monitored the same way, really. And the number one way is by their beam, their behavior, energy, appetite, and mood. And in kidney disease, the big thing is often the appetite, because either they don't want to eat the same variety as usual, or they eat slower, or they don't finish their food, and you need to be journaling and monitoring all that to assess the treatment that you're doing. And the treatment that you're doing is what Dr. Christina said earlier, which is basically, all the conventional vet stuff, which is really mainly fluids and phosphorus lowering if necessary. But the main thing is really going to be energy field balancing, which you can do with a vet homeopath, you can do with an good acupuncturist, even frequent Reiki and healing touch. There are a lot of ways to be doing it, but the most important thing really is giving your dog or cat a sense of purpose. So what they love to do, what they want to do the most, because when they're doing that, kidneys are working at their best. And even though we're taught conventionally the kidneys don't regenerate, I'm reminded of actually this will be a story in my book that's coming up. Heat was a dog who had actually one polycystic kidney, the other one that wasn't even another kidney, and they give him a couple of weeks, 2 months, or maybe a year to live. And the dog's a high performance dog, doing all kinds of dog sports and very closely bonded with the guardian. Basically, by following the strategies that balance the energy field, here we are at year 9, and Heat is a world champion in a bunch of sports. So I guess the bottom line, and there's a lot of questions, so I'll stop talking, but the bottom line is there's definitely hope. Just may have to look outside the box.
Absolutely. And that's the key is really focusing on beam and keeping yourself in that hopeful frame. That's a very, very important chunk. And for everybody, that's something that really is important. By being a member of Holistic Actions, you can post in the forum every day if you need to ask these questions and get responses from us and from the whole community. Okay, Angela. Um, so we have a dog that Springer Spaniel that developed diarrhea, and there's red blood. And so you're fasting, excellent. Giving Forte probiotics, excellent. And Angela, how is the beam?
Well, so his appetite seems really good still. Like he's excited about wanting to eat. His energy is down a little bit. Um, I the mood part I think is a little off, but and the traveling, we've been traveling for almost a week now, and that really stresses him. We were trying to get to the redwoods, so I think it might be stress related. When we
Now,
travel,
when you get to the redwoods, will you be able to stay in one place for a while?
well, for 3 nights, but we're actually considering just going home at this point. Um,
Well,
but
you don't necessarily need to go home for him.
I'm not
The
sure. Yeah.
the thing you need to be working on is the stress for him. And because diarrhea can definitely be caused by stress. So
Hmm.
I would do like 4 times the dose of the probiotic.
Okay.
See if you're in California, you should be able to find there are lots of health food stores and local farms. You could get some raw goat's milk, kefir. There may be, depending on where you are. I know you're not close to a vet, but within the next, as you're going up to the redwoods, there are definitely some stores. And are as you're headed to the redwoods, there is a really good integrative practice that's halfway between Arcata and Eureka, which is up in the redwoods. So you may want to contact them and in case you need an appointment, find out if they can work you in as an emergency.
Okay.
So I would, I mean, it's up to you. If you feel you need to go home, definitely go home. But if you can work with the stress, you could pick up Rescue Remedy at any health food store
Hmm.
and give Rescue Remedy. Have you learned any healing modalities like Reiki, Eden Energy Medicine, anything like that?
Not really. I mean, I know a little bit about prana, but I haven't really done it because
Okay.
Yeah.
So that's something for everybody is the best first aid that you can have are your own hands. And are you a member, Angela, of
I'm
Holistic
not.
Ag? Okay.
Because what happened, a friend told me about this. So thank you very much for offering.
Wonderful. Okay. Well, you may want to look at becoming a member. We have a lot of webinars on doing energy medicine, and one of them by Kathleen Prasad about Reiki is just saying sit with your dog and visualize everything being not stressed, being healthy, happy, the gut is happy, all of that. And so even though you're not attuned in Reiki, you're doing this intention Reiki. And that's good for anybody, especially if you're traveling with your animals or showing, to learn methods. Massaging, another one that we've learned, I learn stuff every week on our webinars with our experts, is to move your hands slowly, incredibly slowly as you're petting, and meditate. Just do this slow. That can actually help the vagus nerve go back into calmness and help the whole body, which can then help the GI tract. So
Mhm.
it's up to you whether you go or go home, but I wouldn't let just the fact that there's diarrhea. The blood is probably just from the gut being irritated. So you probably don't need to worry significantly about that.
Okay.
Make
Yeah.
sense? We look
Yeah.
forward to seeing you as a member. Anything
Yeah.
else?
It was quite a bit more blood because this happens when we travel, like the stress part. So it's not uncommon for this to
Oh,
happen. Yeah.
oh, well, then definitely what you want to do is what I said at the beginning is you need to work with the underlying energy field imbalance that causes this to happen on a regular basis
Hmm.
when you're stressed.
Hmm.
And so that's working with a homeopath, Chinese medicine, energy medicine, that type of thing. Flower
Okay.
essences can be wonderful. And or if he's absolutely fine, except when you travel,
Yeah.
then really start training him, finding out what would make travel less stressful for him. Take 1 hour trip, 2 hour trip, 1 day trip. Try different flower essences, acupressure, massage, how you're thinking. Experiment and find till you can find what makes him a happy camper with you guys.
Okay. Thank you.
Makes
And I
sense?
had one more question because we do have anti-anxiety meds, gabapentin and clonidine.
Well, that's up to you.
Okay.
I would suggest that those are a temporary fix. And I would not suggest those on a regular basis every time you go on a trip. If you want to use them today because you're in a pickle, you could, but I'd try these other things first.
Okay. Great. Thank you.
You're welcome. Okay, Anne, go ahead. Anne, your hand's raised. There you are. What's up, Anne? Nope, disappeared. Okay, let me go down the list. We have Maureen. I saw her up there. So Maureen's dog is has gagging in the morning, and this would be one. And this and the Inna, whose cat is eating grass and vomiting, is those are early warning signs of illness, and they need to be looked at in context. So they're an early warning sign, not of illness, but of internal imbalance. So if you are already feeding a fresh food diet, you may want to tweak that. If you are, everything else is fine, you could experiment with sort of trying a different pattern of waking in the morning. If the gagging is in bed or once he gets up, or if the going out to eat grass is just occasionally, then you'll experiment to see maybe if I get up more gently, maybe if we go out right away, maybe if while you're working to get in relationship with a holistic vet that can rebalance the energy field. But first, you want to do the 101 course and be sure that you're doing feeding a fresh food diet, and doing plenty of exercise, keeping your mental state healthy. So all of those are really key. Frequently, we recently had a speaker who felt that eating grass was not a bad thing, that it was an okay thing. And over the years, if a cat or dog occasionally goes out and eats grass and then throws up, they may have just had a little upset stomach and they're using the grass to help do a little vomit, and it's not a problem. If it's an everyday thing, then you might want to look at making sure there's fresh food in the diet. With cats and dogs, you might want to have either grass that they can eat indoors, for instance. All of those are a good thing as well. So post in the Angela and I'm sorry, Maureen and Inna, if I didn't answer your question, then repost in the chat or raise your hand. And I really like Addison's question. I'm assuming, Addison, and you can nod your head here or you can unmute yourself if you want, that you're asking why are dogs and cats the most common pets? Is that what you're asking? Well, because for centuries, dogs and cats have been living with people, dogs longer than cats. And they've adapted very well to living with people, whereas chinchillas and ferrets and snakes and mice and all the other possible pets that people do have and have as pets, they haven't adapted as well. And they take a lot more, they just haven't sort of fit into people's households as easily. And so they're less common as being a pet. Does that make sense? And then in terms of different kinds of fur, I don't know. The two of you, your hair is pretty similar. But if you look at many friends that you have where you know the brothers and sisters, some have brown hair, some have blonde hair, some have curly hair, some have straight hair. So it's just genetics. It's what you're born with. And that's why animals have different kinds of fur. And many times it's because they've adapted to where they were, where they first became that sort of a species or a breed. Good questions. It's nice to have some different questions in here. So I appreciate that. Okay, Jeannie with the 10-year-old cat. So Jeannie, you're right there. Can you unmute yourself?
Yes, and it's Janine. Yeah,
Ginny, I'm sorry.
Janine.
Janine.
Thank you.
Janine, got it. Okay, sorry. So do you have, are you working with a homeopathic veterinarian or a Chinese medicine veterinarian with Ernie?
No. There's a homeopathic veterinarian over 2 hours away from here, and she requires a first visit in person. And I haven't actually looked online for any online vets yet. I did take, Ernie to the traditional vet where they x-rayed his joint and they also x-rayed his other major organs because they said it's a osteosarcoma, which is very aggressive and usually spreads quickly to the lungs. They saw nothing in the lungs. And he's actually been limping. At first I thought, because he's very active. He's a big cat. He's about 17 pounds, all muscle, no tail. He was born with no tail. But what he lost in tail, he made up in legs. His legs are long,
Whatever.
But he used to just, because I've got like a ledge all the way around the room, and he used to just race around there like a racetrack. But now, now he's not doing that anymore. But I
Sure. So here's the thing, Janine. The key thing is quality of life, what we call BEAM, behavior, energy, appetite, and mood. And we want, regardless of what the condition is, that's our goal, is to maintain that high. And so you're going to make different choices along the way, for sure. Just merely doing the arnica is not enough in terms of homeopathy to be dealing with a severe case of cancer. I just posted, if you go to holisticactions.com/select, there's a free article which talks about finding holistic veterinarians in your area. And so I definitely suggest reading that article, going to the different websites for extra support. There may not be a homeopath right there, but there may be somebody who, chiropractor, osteopath that can help along with working with the energy field imbalance. There are homeopaths who do work by phone who do not need the first visit. And so I would go to the website for the Academy of Veterinary Homeopathy and go put in phone as a filter. And then you can, somehow that just went to Debbie instead of to everybody, sorry. And then you can work with the first person that you can work with. Another thing that can be of good support when you have really severe illness is working with an animal communicator. And
I am.
okay.
Yeah. And I do Reiki also on him every
Excellent.
day. Yeah. Yeah. So,
Does he want the Reiki?
yeah, he loves it. I mean, it's like it's the morning and this is our dawdling time, It's like he wants to sit on my lap and have
Great.
yeah, yeah.
Excellent. And so it's absolutely fine to experiment with different flower essences. Painkiller plant would be fine to try. Flow free, I'm not sure about. I think she has one that's more for arthritis type things. There are two other essence companies, Pet Essences, and so there are many, many different things you can try. And what we'd recommend is, number one, get that homeopathic vet. Number two, as you try different things, try one for a week or two and just notice if it really seems to be helping quality of life. And then if not, move to another one or add in another one. If something's helping and you want more help, then add in another one. So you want to try to keep evaluating. If you're a member of Holistic Actions, you can download the Healthy Cat Journal ebook or the Healthy Dog Journal ebook for anybody with chronic illness. And that's very important to be tracking the symptoms and learning how to evaluate, is this moving us towards cure or not? So that can really help. And if you're not a member, you can get it at my website, which is my name, ChristinaChambreau.com. And so you can get it there. So I would recommend doing that as well. Anything else specifically, Janine?
I don't think so. If
Okay.
it's not cancer, he thought either it was cancer or a very bad fungal infection.
Regardless of which one it is, homeopathy and Chinese medicine will rebalance the underlying energy field imbalance, so it could resolve. We have seen cases of cancer, we've seen cases of severe fungal infections completely resolve, and some of them don't resolve. So that's the process that you're in of being in the moment and knowing that there's always, as long as they're alive and having some quality of life, there's hope.
Stop.
That wasn't me.
I know. Somebody else isn't muted. That's fine.
Well,
okay, Melissa, I'm sorry. Okay, so we got to move on. And if you aren't a member, I'd strongly suggest becoming a member because you get constant support that way with all of the different possibilities. And you're making a good start. You're doing good. Melissa, you've had your hand up for a while. Go ahead.
Hi. So my cat Rosie has had chronic respiratory issues for a pretty long time. And we've tried different things over the years and nothing has really seemed to help. And all the things that we've tried have been conventional solutions.
So,
and like this past year, we had a new type of respiratory panel done, and she was positive for Mycoplasma felis. And the vet recommended a 4-week course of doxycycline, which I did against my better judgment. And of course it didn't help. So I'm just wondering what your recommendation would have been at that point.
Well, at that point, or is your cat still with you?
Yes.
Yeah, okay. So at that point, or now, my recommendation is you're going to guess, right? Get a homeopathic vet, a Chinese medicine vet, um, join Holistic Actions and post in the forum. If you're not already a member, for free, you can do the holistic course, start feeding a fresh food diet, be sure you're massaging, do things that encourage breathing. So do a snuffle mat, hide food and have the cat find the food, take him outside, either on a harness or just sitting with in a like a playpen if you need to. You want to encourage sniffing. That's going to be very important. And work on members of Holistic Actions have access to a lot of webinars on our mental state and improving that and how that can help our animals. Definitely, it absolutely can be resolved. I've resolved whether it doesn't matter whether it's an infection or asthma or allergies or whatever the diagnosis is. So that would be the next step.
Okay.
And come back next month and let us know how it's going.
Okay.
And if you become a member of Holistic Actions, be sure to post this in the forum, and then we can give you more specific ideas.
Okay.
Okay. Nick, go ahead. You're muted.
Okay, there we go.
Great.
Okay, so I am returning again regarding my 22-year-old cat from last month that we've been having. She has kidney disease, and we've been dealing with that for a long time. I think she may have one kidney. I don't know. I'm skeptical of everything that any conventional vet has ever told me. So she has been having a lot of leaking. We've gone through periods over the years where she's had incontinence, and it was always like clear, and then it would go away as mysteriously as it stopped. You know, the last time it went away for 2 years, and then it's back again. It's been terrible. The pee smells really bad. I had her on a long cycle of Zenequin, which is, you know, an antibiotic. That didn't do anything. We've been through convenient injections. That didn't help. We did.
Let's find out what you've done holistically. We know that
Okay.
the conventional doesn't work, period. So that really doesn't help us any. So what
Well,
have
we
you
did. I stopped
holistically
homeopathic
since last month?
last month, per your suggestion, because she developed some crazy swelling in her abdomen and back legs.
And who are you
Um,
working with?
I was
who's your
working with
homeopath?
Dr. Deva.
Oh, David Carcalsa. Okay.
Yeah.
And I think we talked last time about if you feel you're moving forward with Dr. Kalsa, then you continue with her. And if you're not, then you might want to look at a more classical approach of homeopathy.
I don't know what that would be.
Well, that would be going to, I just posted the Academy of Veterinary Homeopathy.
Okay. I didn't know that she wasn't classically.
Well,
I
I'm
didn't.
just, it
Okay.
doesn't matter whether she does a little less classical than some others.
Oh,
But anytime, so here's the thing for everybody. Remember, I said at the beginning, there's no one right answer. There's also no one right practitioner. David Carr has been doing this since 1982 with me. We were in the first homeopathy class together. And she's brilliant and has lots of she's really wonderful. But
I really like her. I just think that she thinks we're at end times here. So,
and when you're working with somebody, whether it's a homeopath, Chinese medicine, osteopath, or conventional, and you don't feel you're getting the results that you want, then it's time to move on to a different practitioner. And I think we mentioned this last time that she felt it was at the end of life. And I said, well, you may want to try somebody who's more positive about that. Number one. And number two, we have a hospice course available. Is that available, Dr. Jeff, if you're not a member or only for members? Only for members. Okay. So as a member of Holistic Actions, you could access our hospice course. And there's also many other hospice courses around, and they're not just for terminally ill animals. They're for animals that are very ill. So all of you with cancer issues and you're struggling with, really serious illnesses, hospice is sometimes helps you tweak how you're thinking so that you're being really positive about it. And it just gives you more resources. So I would go to the Academy of Veterinary Homeopathy, and basically I'd go to the article, holisticactions.com/select, read the whole article and check out who else is in your area to be working with. And because at this point, sometimes you guys are going to ask questions like Angela did with the diarrhea, where, you don't need right now
Well, actually,
veterinarian.
she squatted in the middle of the bed and peed.
Okay.
Night before last. My house, the leaking that she's doing smells really bad. It's never been like that. I never thought that I would have a house that smelled like cat pee. I have potty pads all over the place. It's still, I mean, she deliberately peed in front of me like that.
She's
That was
she's asking for some different help.
Yeah, and I've tried 4 different homeopathy remedies, and I don't know.
Those are ones that Dr. Kalsa prescribed.
Yes, and then we went into a different direction, and she had all this abdominal swelling and hind leg swelling. The hind leg swelling has gone away. The belly swelling is still there. It's not as bad. It really scared me. I don't know where to go now.
Where to go now is either continue working with Dr. Kalsa or go to the article, holisticactions.com/select, and start working with another virtual homeopathic veterinarian. That's where to go now. And or move to doing conventional medicine. Sometimes, and I would at this point work with a communicator and do the hospice, maybe look at some of the hospice websites.
I went to the vet yesterday and I just stood in his office and I asked for a different antibiotic and I got one. I got Baytril. I haven't started it yet because I was waiting for this. I mean, this is not how I want to end our relationship, with her peeing everywhere and her unhappy like this. So,
Dr. Jeff, what could you put in the website, in the chat, our Dalma? So we have somebody that can help you navigate this challenging time to be more positive, or any others you think Dr. Jeff would be good. So if you would go look at that, that'll be the third next step that we're giving you. Let's go on. I want to do a quick answer here because we're got lots more questions. So Miyoko asking, what kind of support practitioners should be added to the team? Her dog is going to have an ovary-sparing spay in about a year. So if you're not a member of Holistic Actions, Miyoko, I would do the 101 course. I would look at becoming a member, because the support that you want to do is everything we do to have an animal be healthy. Feed a fresh food diet, meditate, energy healing, plenty of exercise, lots of love and caring, and be very cautious when it's time for the surgery that you don't worry, that you're positive, this is a good thing, we're going to be doing this, etc. And then pay attention to any symptoms that are going on. And if you're seeing any little clues like early warning signs or decrease in beam before the scheduled surgery, reschedule the surgery, because it's not a has to be done right now kind of surgery. And always, the more holistic practitioners you have on your team, an intuitive animal communicator, a holistic veterinarian. So I would read the article on finding a holistic veterinarian and having them on your team now, not just then. But at all times. So hopefully that helps with that one. And Jenny Care asks, she said her 3-year-old dog won't drink water. I guess she won't drink broth or goat's milk. Very often, dogs who are fed raw do not drink a lot. And cats who fed raw often never drink because their kidneys are set up to work that way. And some dogs can go without urinating for a long time. A service dog that my friend who I stayed with recently, her dog, they were on a flight from Amsterdam to Portland, Oregon, a direct flight, and the dog did not urinate for something like 20 hours. And as I was with her, I picked her up at the airport. We found some grass, and the dog was like unconcerned, sniffed around. I mean, she wasn't like panicked. Oh my God, I've got to pee. I would have been. And so different animals are different ways. So as long as nothing else is going on, and your dog is healthy and feeling good and active and playful, I would just keep a note of that in the journal and pay attention. So for me, I wouldn't worry about that. Dr. Jeff, any concern that I'm missing
No,
on that
really,
one?
as long as beam is good and everything else is fine, not peeing. I think more people complain about, they have to get their dog out every couple hours. So I guess not urinating is okay.
So thank you. And then Erica, basically all the questions I just talked about, when we have old kitties, it really is important to be working with an animal intuitive and an animal communicator to find out what would make things be better for them. Sometimes when cats are urinating out of the box with elderly cats, especially when they have some urinary tract problems like stones, you may want to have a box that's flat, that is just like a food tray to make it easier to go in and out, because he does go directly to the box sometimes. And it may be more of a mental issue as well. That could be part of the problem. So often it is management, and sometimes reaching out to hospice courses helps you manage these urinary problems or appetite problems or stool problems or mobility issues, which our older animals can certainly have. And when you say you gave homeopathic remedies, if that was prescribed by a homeopathic veterinarian, then you need to really stay on top of what's going on. And if you're not a member, you can search the forum. If you're a member, you can post in the forum, and we can give lots more specific ideas. When you say you've tried some homeopathic remedies, that's why I want to follow up. The other thing is when you get the Healthy Cat Journal, I talk a lot in the journal about evaluation of response. And as members, you have access to a lot of webinars about evaluating the response to any treatment, whether it's homeopathic treatment or other treatment, so you can know whether they're moving towards a real cure or just temporarily helping, like steroids and antibiotics usually do, or making things worse sometimes, which can happen even with homeopathic medicines. Go ahead.
Yeah, it was prescribed. I'm in Utah, and we have a good holistic veterinarian here, Dr. Kim Henneman. And then
Okay.
a couple of them were your suggestions. I think it was 2 times ago, but we talked about him. So both you and Dr. Jeff mentioned one. And then we also saw Dr. Edward, whose last name is escaping me. He's in Australia.
Yes, Dr. Edward, you can't pronounce it, neither can I. Basing weight, Basing weight.
Yes. I didn't want to murder it because I couldn't remember it well, and I didn't want to be rude.
Yes. So you've worked with him. Was
And we
that, did
had
that
a
help at all?
we had a virtual with him, and I think his energy work definitely helped in the short term. The remedy that he suggested didn't do much, and we had not found out about the stones yet. We had the x-ray after Dr. Edwards' visit to actually confirm the stones.
Okay.
We were working in urinary tract overall, behavior, dementia, mobility. We were still in those paths. And then we saw the stones and we switched gears all around, and we've
Mm-hmm.
changed food, we've changed, like, everything is focused towards
Yep.
stones. So
And that may do it. And again, if you haven't done an animal communicator and intuitive healer, you
we
might want to add that
have
in. Okay.
We have worked with Lydia Hibby for
Oh,
many
good.
years.
Okay.
She's so wonderful that everybody wants her, and she's tough to get in with. But I feel like that is truly our next step, because I don't know what's going on. We're not figuring out what's going on. Like, we need to talk. I need to
Great.
talk to him. So
So I would do
hopefully,
that, but also I would check out the different, I would check out the hospice course that
I've
Gail
actually
Pope
I've
does.
taken Gail's
Okay,
hospice course. My intro, yes.
good.
Gail
Did
is
that help you?
one of my favorite humans. So many
Oh,
years
good.
ago on this is Gail started me on the path.
Perfect.
My
Well,
training was done at Bright Haven, and
oh,
so I've
wonderful. Well,
taken her.
you can call her and do a consult with her.
I was thinking of that as well. Yeah,
Yes,
because
absolutely. And that will help with the urinating,
okay.
how to manage it.
Yeah, because we actually we call them our handicap boxes, our geriatric senior
Good.
boxes. We have towel boxes.
Mhm.
My husband had a box manufactured with his fabricator that he works at with work to specifically make it easy for the kitties. They're huge, they're square, they're
Good.
flat. They
That's
have
great. Good job.
short
You're
entrance. Yeah,
you're moving in the right direction. Okay, I think you
definitely.
have your next steps, and keep
Thank
us
you.
posted
Thank
for
you.
sure. All right. And just a comment, Whitney, this would be for Angela with the stress and traveling. Essential oils, you can certainly try those. There's more than lavender is good, but there are other ones. And so you always want to have good quality oils for sure. And quick answer for Annette is a non-surgical ACL tear can be managed with homeopathy, Chinese medicine, which is excellent for that, chiropractic, osteopathic, and sometimes braces. We've had a speaker, one of our holistic action speakers was Hero Braces. And so you can, I think it was that company. And so you can learn about that as well. And Annette, you're right there. Did you have a more specific question, or did that answer it? You'd have to unmute.
Hello, thank you so much for taking my question. So, I have some experience. Professionally, I work with manual therapy for humans. I do the Feldenkrais method, and I really want to support my dog as well. I wanted to know if there, in terms of manual therapy, any suggestions, anything I should avoid while working with him.
Stay very present and listen and pay attention. Where a person's going to tell you, "Oh, that hurt," you have to intuit that with your dog. And then I would also go to Dr. Jeff, you could post this, Laurie McCauley, for anybody who wants to have healthy mobility at any age or with any condition. Dr. McCauley has a whole lot of YouTubes on different things to do. And she also does virtual consulting. So you might be able to do a consult with her that would help point you in things to watch out for and be careful about.
Thank you so much. I appreciate
And
it.
then become a member, fresh diet, all the things we've talked about.
Are there any supplements that can facilitate this period?
There are lots of different supplements, and you have to sort of go, again, if you don't want to become a member, you can go and search our forum, and you'll see different people talking about different supplements. And if you become a member, you can post and say which ones you've tried and what other ones then we could direct you to some of the other ones. Glyphosate, chondroitin sulfate, alpha G. There are many, many different possible supplements.
Thank you very much.
You're welcome. Quick answer, pica is not hereditary, Debbie. It's a sign that the underlying energy field imbalance, that there is an underlying energy field imbalance. So could that be inherited? Maybe, but not directly. It's not like pica is inherited. It's the underlying energy field imbalance might be inherited. And Addison wanted to know why Sadie is getting gray hair. It could be the breed. What breed? It could, if that's Sadie lying there, it's just hair color does change with, it doesn't necessarily mean aging, and it doesn't mean something negative. Any other comment on gray hair appearing, Dr. Jeff?
Nope, it's, as you said, it's directly related often to what they're born with, the breed. Can be related to environmental stressors, but most commonly it's because they have something in their DNA, and the DNA is kind of what makes up the dogs, what makes up their being gray or not being gray.
Great,
So
thank you.
Not to worry.
Okay, Anne, go ahead. You've been patiently waiting.
Hello?
Hi.
Oh, good. You can hear me. Hi. Hi, Dr. Jeff. I've been communicating with Dr. Jeff. Buddy hasn't really been eating. I mean, if nothing else, until the end of August, he had a very healthy appetite, ate very heartily, everything I put in front of him. In August, he had 6 seizures in one day, and he's been not eating well since then. So I worry that I'm not feeding him enough or the right kinds of food. So he doesn't seem at all interested in dog food anymore. Like I was trying to give him healthy, like Honest Kitchen and the raw, different kinds of raw foods, not my own preparations, but through all the months since he was
diagnosed. Let me just I found your post. So because we're down to 4 minutes.
Okay.
So yes, feed anything he absolutely wants to eat.
Okay.
Absolutely anything. Don't worry about balancing it. Just whatever he loves.
Okay. Even like McDonald's hamburgers.
McDonald's hamburger, ice cream. And
good.
Like if there's something he likes and you can find a healthier version of it, then feed the healthier version. If he likes McDonald's burgers, but you could instead make him a hamburger with local organic meat.
Yes, I would do that. I'm just saying that because I heard
exactly
a story about a man who fed his dog McDonald's hamburgers and he lived for like 2 years. But anyways, no, I would never give him a McDonald's.
So there's no one right answer. It's about happiness and quality of life. And there's a supplement that Song Company puts out called PDG, Pre-Digest, for anybody who's dealing with cancer, seizures, severe illness, and they aren't eating and losing weight, or they've lost weight and you're trying to put weight back on. This is a powdered pre-digest, really good. Also, think about things like that are extra good for the gut. So fermented things, fermented beef broth, etc. Things like that.
He won't eat that because I ordered some from your website. Yeah.
All you can do is experiment.
But he does eat kefir, and he does. Now this is another question. I was giving him for months. I was giving him the Proviable Forte. But then when I ran out of that this time, I decided I'll try something different. So I bought it's a soil-based probiotic.
Good.
And it's powdered, but he doesn't seem to like it in his food. So this morning I tried squishing it in with cheese and he ate it from my hand that way, but it was a total mess.
Perfect.
But I'm wondering if you have any suggestions about how I can get powdered in.
Well, there are multiple different probiotics, so you may want to explore and find one that works. Fortiflora is very palatable. Mitomax is very palatable. So there are a
Well,
number.
I could continue with the Proviable because he took that no problem, but I just thought I'd try something different.
It's good to rotate probiotics.
Yeah.
So I would go back to the Proviable, but then I would experiment with these other ones as well.
Is there any way, like suggestions you might have for getting a powdered?
You just did it. You did it. You mixed it with cream cheese. That's perfect.
Oh, okay. Just deal with the mess. Okay.
Yeah.
Yeah, he does seem to be eating from my hand when he won't necessarily eat from the bowl, but
Good.
yeah.
Okay, we
So,
need to move on.
thank you. Thank you
Keep asking Dr. Jeff and going on.
Thank you so much.
Quick answer
Dr.
for
Christina,
yes.
this is Debbie. You had answered my question about pica, but I had another one asking
Actually,
you.
Debbie, I'm sorry, we've got a couple of others we have to move on to. Sorry.
Okay.
Okay. We just have a minute left. And so for everybody, be sure, think about becoming a member of Holistic Actions, and you can post your questions there. And anyone here who is a member, post your questions if we miss them. And that particularly applies to William and the seizures, because I know, William, that you're a member and that we've talked about this on our 15-minute calls, I think. And so I would, you have a long, complicated answer. And I've answered a lot of it in terms of we have to just keep trying different things. And I would say that your homeopathic vet is suggesting you can gently wean him off the drug, and it may not be time yet. He's just saying that could happen. And so you need to be in communication. If you don't feel comfortable cutting back, then don't. Be in communication. This is for everybody. Whoever you're working with, you are your animal's ambassador. Learn about evaluating response. Keep a journal, and you say to your veterinarian, this isn't working, or I'm not ready yet, or tell me why it's okay. Now, I'm a little concerned that, once a day and once a month. Okay. So you need to be tracking all the symptoms, not just one or two. And that's the close. Seizures are scary, I understand, and it can be a challenge. So be sure, for those of you that are members in dealing with these multiple challenging situations that we're covering today, we've had some ill animals today. And I just want to, it's really important to focus on your mental well-being, because what you're thinking puts out vibes out there that are measurable and impactful, and these do impact on everything that's around,
I believe
including your animals. So that is important. And I think we're out of time. And Nick requests, Dr. Jeff, if you didn't see it, that we share the chat because she missed it. So, okay, Dr. Jeff, you want to close this out? And maybe we should do this twice a month.
Well, thank y'all. Thank y'all for coming. Thank you, girls. Say hi to mom and everyone. Thanks for being here. We'll be back next month. If you have any questions, as Dr. Christina said, post them on the forum. If you're a member, if you're not a member, think about joining us for a month, or more. And Monday, if you are a member, it's going to be a tour of the website and the forum. So 8 o'clock Monday is going to be Aruna explaining everything that you can do with the Holistic Actions. And for everyone else, we will see you in October on last Friday. And otherwise, thank you for being here. Thank you, Dr. Christina. Great job as always. Bye-bye.
Bye.
Bye. Thank you.